My case study presentation is on lung cancer. There's three main types of lung cancer. We have the non-small cell lung cancer. This one's the most common out of them all. About 85% of lung cancer patients have this type. And then we have the small cell lung cancer. And this is the next most common, and about 10 to 15% of lung cancers. And then this type does spread very quickly though. The last one is lung carcinoid tumors, and this is the least common. Only about a little less than 5% have these lung cancers. And this type of tumor grows very slowly and rarely spreads. Here we have some lung cancer stats. Lung cancer is the most common cancer, second to prostate cancer for men and breast cancer for women. The American Cancer Society estimates that there will be 224,390 new cases of lung cancer and 158,080 deaths from lung cancer just in 2016. About 1 in 14 men and 1 in 17 women will be diagnosed with lung cancer sometime in their lifetime. These risk factors are definitely higher when tobacco use is involved. Here are some risk factors. Obviously, tobacco smoke, first-hand or second-hand smoke. If you look in the top right corner, we have a non-smoker's lungs and then a smoker's lungs. Look at the toll that smoking takes on your body. That's from all the tar of burning the tobacco and the smoke also. Then we have exposure to radon. Radon is just a radioactive gas and comes from the breakdown of soil and rocks. Then we have exposure to asbestos. This is found in mold most of the time. And then air pollution and family history of lung cancer. There is a genetic component in there that lung cancer can be passed down from generation to generation. Some signs and symptoms: a cough that doesn't go away or just keeps getting worse. Chest pain that can be from deep breathing, coughing, and even laughing. And we have shortness of breath, being tired or feel fatigued, and infections such as bronchitis and pneumonia that just don't go away or just keep getting worse. And another one that I didn't list on here that's very common is coughing and spitting up blood. The diagnosis of lung cancer, the symptoms don't usually show up until after the disease is already advanced far enough that it's at a non-curable stage. Most lung cancers are actually found accidentally when testing for other medical conditions such as like bronchitis or pneumonia. Screening is a term used for tests and exams to find a disease when people don't actually have the signs or symptoms yet. The most common one for lung cancer is the low-dose CT scan, and that is one where you lay down with a circular tube and they put you through the tube. It does make a lot of noise, but it's not very long of a process, and then you get your results there. Treatment of lung cancer. And this all depends on the stage and the size of the cancer, but there are a few ways that we can treat it. Surgery, if you're lucky, they can get a lot of it out, but you will still most likely have to undergo radiation therapy and chemotherapy. But there are side effects to these treatments, such as fatigue, nausea and vomiting, and sadly pain. For exercise and lung cancer, the right amount of exercise can really make the patient feel better during their treatments. This goes for everybody, even if people don't have cancer. Like exercise in general just really can make people feel a lot better, have a better mood, just feel better about themselves. Even low intensity movements such as taking a walk, this could be like just taking your dog for a walk or going to get the mail in the mornings, and then light stretching when you wake up. These can be great exercises for patients with lung cancer. Moderate intensity exercise during lung cancer can improve a lot though. It can help with fatigue, lessen anxiety, have less stress, depression, and it can improve your self-esteem. And then obviously it can improve your cardiovascular fitness and the muscular strength, as well as your overall just breathing. Case study that we have here is actually my grandfather, and his name was William. He was first diagnosed with cancer on the base of his tongue, and it spread to his lymph node, and then it spread down to the right lung and the lower lobe, and he was diagnosed with lung cancer at the age of 77. So he's a little older to start with. But William also used a Symbicort inhaler twice a week for his COPD, Cardizem for his high blood pressure, Lipitor for his high cholesterol, and then William was also prescribed metformin for type 2 diabetes, even though he was not diagnosed with type 2 diabetes. He was diagnosed with pre-diabetes, where his fasting glucose was still pretty high, but didn't actually put him into the category of type 2 diabetes. With some patient details, still continue here. William was undergoing radiation and chemotherapy treatments, so he is going to be a little more fatigued. Risk stratification here, I have in bold red letters either yes or no for it being a risk factor or not. Age greater than 45 years old, obviously he's 77, so that's going to be a risk factor. His high cholesterol, he was taking medication for high cholesterol, but his cholesterol levels were normal actually, and that was only because of his medication. So that's going to be a risk factor still. And then same thing with the blood pressure. His blood pressure was normal, but that was only under medication. Type 2 diabetes, we still actually said no, just because he was not actually diagnosed with type 2 diabetes, even though he was still prescribed medication for it. His COPD, he did take his inhaler twice a day, so it's not fixed or only because it's taken care of by medication. So that's going to be a risk factor, definitely. And then lung cancer obviously is a risk factor. So William is a high-risk patient. The goals of the exercise program, we want to decrease his fatigue, improve his self-esteem, improve or maintain his cardiovascular fitness and his muscular strength. For William, we really just want to improve his overall quality of life. For exercise testing, maximal testing is definitely not recommended for William. Submaximal testing is okay, but we definitely want to have that physician present still. The exercise test chosen for William was a cycloergometer. We want to keep it in between the 8 to 12 minute range. And then we'll start out with very minimal or even no resistance at all, because he is 77, so he's obviously older. It's harder for him. He's already tired because of his treatments that he's undergoing. So we want to be able to make it through this protocol. And then every 3 minutes, we're going to increase the resistance just a little bit. And this is all going to be under the physician's discretion, though. The exercise prescription for William, aerobic training, we want to get about 3 to 5 days per week. And we chose to go with RPE for intensity. We're using a 6 to 20 scale. And we want William to stay in between 11 and 15 during his exercise duration. The time of each session, the goal is to get 20 to 30 minutes. And if it can't be done continuously, that's totally understandable. We'll just break it up into shorter bouts. We can do about 2 to 3 minutes of exercise, then have about a minute or two rest, just so we can catch his breath. And then we'll repeat that, go back into the exercise, and then go to rest. We'll just keep going all the way up until he hits his 20-minute mark. Some types of exercises you can do is just be walking, either on a treadmill or it can be outdoors. Like earlier I said, he can go walk his dog, or he can even go walk in the park or something. If he has access to a gym, he can use a leg or an arm ergometer. For resistance training for William, we want to get about 2 to 3 days per week. Intensity, we chose to stay with RPE between the 11 and 15 range. We're going to get about 10 to 15 repetitions per set. About 2 to 3 sets per exercise would be great. And a total of 8 exercises. And we want to go with exercises that involve the major muscle groups. He can use elastic bands, free weights, and then again, if he has access to a gym, we can do weight machines. Just the exercise prescriptions still continue here with the flexibility and balance. This can be done daily and doesn't have to be for long, only about 5 to 10 minutes a day. We want to hold to the mild point of discomfort. We don't want to hurt him. He's already very tired from his treatments. He's older. He's losing his muscle from the treatments and just being more bed rest because he's not being as active as normal. So he's frail. We want to keep him safe, keep him not from being hurt. Some exercises we could do is static stretching, and then also yoga. Yoga is great. It helps with flexibility, it helps with your balance, and balance is really key when you're losing this much muscle mass. It's hard to maintain your balance. A lot of people, especially when they're older, they lose their balance to begin with. And then once you add losing muscle mass on top of that, at the rate that they do when they undergo these treatments, it can really take away from their activities of daily living. So what I really want you to get out of this presentation is that lung cancer can be best cured when it's caught early. Lung cancer can also be prevented, even though sometimes it is genetically passed down from generation to generation. You can still give yourself a better chance of not developing it, such as just not smoking or avoiding secondhand smoke of others. If your job puts you in a dangerous environment where there's a lot of cancer-causing agents, you can just, I know it sounds wrong, but you could try to find a new job that puts you in a safer environment, or you can just keep the same job and undergo screening regularly to make sure you're safe. And then also, exercise can't cure lung cancer, but it can definitely improve the overall quality of life while living with cancer. And this can be for mainly the patient, but then it can also help improve the quality of life for the spouse or for the family. If the patient is exercising, they have their mood, are in a better mood, it can put the spouse in a better mood. It can put the family in a better mood. If the patient has a more positive outlook on their cancer and their other situation, has a positive outlook on the future, then it can make the whole family, make the spouse really think positively. And if the cancer patient just isn't feeling up to it one day, they can just have the spouse there for them, knowing that they'll be there and that they can try to motivate the cancer patient to just keep pushing, to do your best, go out there and exercise. The exercise, every time you do it, you might feel tired, yes, but then afterward you feel better, you feel great about it. So this is what I have for my presentation, and then we also have my references right here.